Hope everyone's doing well and hope everyone is excited for this really great webinar. So it's going to be really interesting. And if anyone's been listening to my webinars, it's all about motivating you to achieve your optimal health and wellness. So that is the point of it. I hope that I'm here to inspire you guys, and I hope that you're going to learn a lot of things that are new, or at least put it into perspective. So enjoy. Feel free to take notes. Anyone who's registered for this webinar, you will get a copy of it emailed to you. This is also going to be uploaded to our YouTube page. So let's jump right in. So anyone who's new to this, I am Dr. Dawn, and pleasure to meet you. I'm a naturopathic doctor as well as acupuncturist. I'm also a Reiki practitioner. I have a history of doing personal training, so working out and getting the body moving. I definitely support that wholeheartedly, but having the right support for you, choosing the right exercises to support your stress hormones and support your overall health is a big piece of that picture that I love to talk about. And I started this health journey as a health coach. So why am I talking about the eyes today? Eyes are the windows to your soul, right? We exude our vibe to the world through our eyes. We're always reading other people's eyes. So it's really important, and it does represent our overall health. So this talking about the importance of the eyes goes all the way back to, the beginning of time. So I love talking about this. And naturopathic medicine can do a lot to help our eyes. And what is naturopathic medicine? So it's all about preventative medicine, and it's getting to the root cause of the imbalance. So if you're feeling dryness in your eyes or blurriness in the eyes, think deeper. It might not just be in your eyeballs. The root cause can be something else going on. And then in turn, you fix that and you feel better overall. And I'm going to be talking about nutrition, healthy habits, all the good lifestyle choices you can be making, as well as some good supplements that I'll talk about towards the end. So the AOA recommends comprehensive annual eye exams with the eye care professional. Now with everything that's going on, people do not want to make appointments, but I'm here to tell you there's a lot that you can do, but a good reminder also, get your eyes checked, okay? Monitor your eye health. It's great to maintain proper vision, review any UV exposure risk that you may have. They can tell you this. So going to see your eye care practitioner can really help preventatively too. And track your UV protection needs. Also recommend a lens color for your comfort, and stay up to date with, all the latest advances in eye protection. So here's the anatomy of the eye. So if this interests anybody, feel free to watch this over and you can really study this. I'm not going to go too into detail, but I wanted to provide this for you guys because it is important to look at. Of course, in naturopathic medical school, we really went into depth with this. And there's a lot to our eyes. And so I'm going to go through it. So the orbit, that's the bone, and all of we've got cranial nerves. I'm going to talk about them that are connected with our eyes. And the sclera is that outer covering. The conjunctiva, which I'm sure that you've heard of, that's that thin, transparent layer of the sclera. It covers the back of the eyelids and the eyeball too. And that's really important. So remember the conjunctiva. The cornea too, what is that? That's our external protection against the environment that our eyes have to help us. So it's right in front of the iris and the pupil, and it's there for our protection. We all know about the pupil. The iris is important, and when I'm going to talk about inflammation in the eyes, and it's the circular colored area around the pupil, and it controls the amount of light that enters our eyes. And the uvea there is that middle layer. It includes the iris as well as the ciliary bodies, which are those muscles there in the choroid. So that's the middle layer within our eyes. The lens is behind the iris there, and it changes shape. It helps with our focus of light onto the retina. And our retina, so this is really important, it's our nerve layer lining in the posterior, which is the back of the eye. So I'm going to be talking about the retina a lot. It's really important. And there's an order of light that passes through the eyes, right? We know that our eyes help us to see. And then again, the cornea is right there. That's where the light enters, and it helps focus light on the retina, which is at the back of the eye, okay? And then all the other, everything else is listed there. For the sake of time, I won't go into each one, but it's there for you to read. But I want to pop down then to the retina, where it receives the light, it converts to neural signals, and it creates impulses to the brain to then interpret the images. So what does this mean? That our eyes are connected to our brain, connected to our mental wellness, connected with our overall health. Okay, so something to really think about. These photoreceptors, so we've heard of cones and rods. Cones have to do with our central, we've heard of macular degeneration. And then rods have to do with night vision and peripheral vision. Okay, so just a little brief overview of that. And now our cranial nerves, how these affect our eyes. And there's cranial nerve disorders of the eyes. So what does this mean? It affects the vision, the movement, and sensation within the eyes. And there's 4 cranial nerves: optic for sight, obviously ocular, motor, trochlear, and abducens. So all about the different motions of the eyes, the eyelid. Really important. So symptoms of cranial nerve eye disorders. So there's my little Chloe. If anyone listens to my meditations, she's the true star in those weekly meditations. And it is Happy World Meditation Day, guys. On a little side note, and meditation is great for overall health, decreasing stress, which in turn can help to support our eyes too. But why do I have a picture of little Chloe here? So years ago, I found out that she had retinal degeneration. Poor little pup. So her central vision is going. And so here's a cute little story. I went to the veterinary ophthalmologist. Yes, that exists if anyone was curious. And because what was happening was she was bumping into things. So if anyone has a pet, don't feel bad if you missed it. Because this went on for months, if not maybe a year, and I wasn't noticing it. Because pets, they get really acclimated to their environment, and so you can't tell when their vision is going because they're using their other sights. They tune into them. And so I wasn't able to notice it because she wasn't bumping into anything around me in my apartment. But it was when my brother and one of my really good friends watched her, and they're watching her for a day, and they realized that she was bumping into things. So when I had 2 people tell me that, I went to the ophthalmologist, and I got the really sad news that she was losing vision. But the good news is I went back a year later because he gave specific ways to monitor how her eyes were looking. And because he told me his prognosis, the first time I saw him was that within 3 months max, and she was going to be totally blind. And he gave me a supplement, which I wasn't too fond of. It was actually missing a supplement that humans need for their eye health. So I just assumed, it was missing it for the dogs. But I did use homeopathy with her. So phosphorus is what I used for her, and I put it in her water. And I went back a year later, and I knew her vision hadn't gotten worse because nothing had progressed. And she could still have her peripheral vision. So that's a good thing. She can still see things. And to this day, so this was years ago. God, this was she's 8. This was about 4 or 5 years ago when this happened. She was pretty young when it set in. And her vision is exactly the same. So I went back a year later, and he didn't want to look at his nose. I remember this. And he looked at her eyes, and he said exactly, he assessed her eyes, and they looked at his notes, and he goes, it didn't degenerate. She's not blind actually. And he asked me what I did. He had no idea what homeopathy was, but he said, go ahead, keep doing it. So that's what I do. So there is hope, we can love them a lot. And I've done Reiki on her and all these wonderful things. So even though you have an eye disorder, there's a lot of hope with healing, and hope is a big part of wellness. So anyways, but symptoms with cranial nerve eye disorders, so there could be blindness, right? What I was just talking about, double vision, paralysis of the eye, and even drooping of the eyelid. So the optic nerve, this connects the eye to the brain, and it's located right near the retina. So meaning a retina is essentially an extension of the brain. So our brain health is so important. So we really want to protect our eyes to support our overall brain health with cognition, emotions, how we're feeling mentally, anxiety, depression. This all plays a factor. So when you protect your eyes, you're also protecting your brain. And the health of the retina has a lot to do with brain functioning. And like I was saying, our eyes exude our vibe to the world. So see your best, feel your best, right? This kind of all goes together. So here's a picture with some retinal imaging showing some of the blood vessels there in the retina. So I will advise, I've advised patients in the past to go for retinal imaging. So when you're having some Early onset symptoms of cognition is off, some brain fog, your memory loss, things like that are going. Check out the retina and see what's going. It's the early way of detecting any neurodegenerative diseases. So before symptoms advance, you can find out if something's going on by just doing this. And it's non-invasive, and it gives a lot of information. It detects these ocular, eye, and systemic diseases early. So it's not just the eye, remember, it's your whole body, but the eye can be a reflection of your whole body. Systemically means whole body, okay? And there's something called optical coherence tomography angiography. So, but ask for the retinal imaging and take it from there with your eye care practitioner. And that's what this is all about, early detection. So preventative care. So ask for this. So it's early detection with Alzheimer's disease, diabetic retinopathy, glaucoma, macular degeneration. So that's what, macular degeneration we call in humans because we live long enough for it to generate. It's called retinal degeneration in our little pets because their lifespan is not as long. But in essence, it's affecting their central vision. Artery and vein occlusions also. Okay, so know your family's history. So yes, there is that factor. Many eye diseases are hereditary, but that's not the main factor. What I always talk about here is about epigenetics. So genes are a factor, but we have so much control over whether or not these bad genes get turned on or off. And we want to keep the bad genes turned on. And we can do this with something called epigenetics. So epigenetics, that's everything I'm talking about. Those are all of your lifestyle choices. What food you choose to put into your mouth, how stress affects you, how you cope with stress, your overall health, and the choices that you're making are your epigenetics. And we have so much control over our health and wellness. So it's not just about the genes, but it's a piece of the picture. So, knowing your family's history, knowing what potentially could be, later on down the line for you, maybe that could be a motivating factor to really step up your wellness. So always trying to use information to empower you. If it's something that's going to hamper anything or bring you down, know your limits, know what information is going to be good for you. Be with a practitioner who can guide you through it. So always knowing what works for you. Dry eyes. So this is a big thing. Okay. Are you dehydrated? Are you drinking enough water? Okay, this is huge. So you want to be drinking at least half your body weight in filtered ounces, in filtered water in the amount of ounces. So let's say you weigh 120 pounds, you want to be drinking 60 ounces of filtered water a day. Really important. Making sure that you're having proper bowel movements and all this stuff, so that you don't have heavy metal toxin load. I mean, there's a lot to think about when it comes to dry eyes. But are you hydrating enough? And are you absorbing enough as well? So things to talk about with your healthcare practitioner. Low iron, something called ferritin is iron storage. And sometimes I see this a lot, especially with women who have low iron storage because, we think about with dryness and what's the liquid in the body, the liquid of life, blood, we want it to be flowing. We want enough of it. And that also nourishes our eyes. So making sure that our iron levels are right where they're supposed to be. You don't want ferritin too high because that can also be inflammatory. So having it right where it's supposed to be. Okay. And what takes a toll on your eye health? So any chronic conditions. So why is it so important that we have chronic conditions in check? With the situation going on. You don't want to be in a pandemic and then say, oh, now's the time to get my health in check. But many of that, people are dealing with that now, and that's okay. If now's the time where it's a wake-up call for you, so be it. But you always want to be on top of your health. And if you have any chronic conditions, get ahead of them, reverse them. If anyone's listened to my talks before, I've had to reverse 2 chronic conditions. Conventional medicine, and in fact, wouldn't even help me. There was no way to even, one of them with my autoimmune condition, I was going around for decades undiagnosed. I had to do specialized tests to find out what was going on in me. You reverse that chronic disease, you reverse that chronic inflammation. If it's possible, there are ways to naturopathically support your body with chronic illness too. To really bring it back to something called homeostasis, bringing the body back into balance. What also takes a toll on your health, these poor habits. And these poor habits can lead to these chronic conditions too. So, sometimes we really know what's that we're doing things that aren't good for our health. I know this. We all know this, because I'll have patients and I'll just, I'll ask them, what'd you have for lunch today? And they're just like, oh, you don't want to know. Or they'll start laughing. I get all these responses because they know what's good for them. We all know what's good for us, right? We do. Why do we make poor choices for ourselves? But you do it over and over, and it's really affecting your health. Okay. So if it's showing up in your eyes, really think about, is it affecting your whole body and what's going on? So two major factors that we can control for optimal eye health, or try to have control over it. Okay. Eating nutritious food. So nutrient dense, actual food, right? And trying to maintain a healthy weight. And if that's an issue for you, really getting to the root cause of what's going on. And so I want to talk about this now, our immune system and our eyes, and I'm sure we don't think about it. So I love this picture of the froggy, because he's really super cute, but look at those eyes. They're red. I mean, he looks pretty healthy. He's like all colorful, and it looks like those are the eyes for him. But if this was a human, okay, those eyes are super inflamed, not what you want to do. And, when there's thyroid issues, you see, when the eyes are popping out like that, that's a sign of some issues within the body, right? That you want to get control of. So I love that picture for a variety of reasons. But first and foremost, he's super cute. Okay, but with our immune system, so if anyone's listened to my previous lectures with lung health and talking about mucus, so we have mucus membranes throughout our body, and they are also in our eyes. And why? So there's a physical barrier that they're there to support us, and there's key parts of our immune system in there. So there's DNA, proteins, and antibodies, okay, that are in this mucus. So it's there to protect us, but you don't want too much of it, right? Because when there's too much mucus production, then viruses, bacteria just can be stagnant in there and they don't flush through. So that's not what you want. You want just the right amount of mucus. And so you want to support your eyes and support this immune system, that occurs, and it's happening even within our eyes. And with autoimmune diseases, they can settle in the eyes, and there's tons of them actually. Sjogren's, I just listed one of them because this is a really popular one. Popular in a bad sense. Like autoimmune disease, we want to keep this at bay. Okay. If you know that you have an autoimmune condition, reverse that ANA, reverse your inflammatory markers, feel better. I'm here to tell you, you can feel better by making some good choices for yourself. And if you're stuck there, find someone who can help you. Okay. And monitor that ANA, because you'll feel a lot better if you can reverse it. Okay. If you have the type of autoimmune condition that you can do that with. But with Sjogren's, so you have a dryness of these mucous membranes, and a lot of people experience dry eyes. And it's this dryness, and it's painful. Okay, there's like scratching that you can feel, like corneal abrasions going on. It's really painful, but you can also have systemic mucous membranes. So it's not just the eyes when you have it, but a lot of people do have the symptom with the dry eyes. So you want to find out, why is it dry eyes? Is it dehydration? Is it low iron storage? Or is there an underlying autoimmune condition and there's chronic inflammation? That's the reason for these dry eyes. You don't want dry eyes, okay? And there's a lot of manifestations within the eyes when it comes to autoimmune diseases. So things like conjunctivitis, uveitis, keratitis. What is this itis? That's the inflammation, okay? And there can be scarring in the eyes, corneal ulcers. And there's tons of that. I mean, the list goes on and on. So this in itself is a whole lecture. So I tried to keep it minimal. But unfortunately, blindness. So we really want to keep our eye health and our overall health in check. The ocular immune system, no one really talks about this, but our eyes, so it protects our eyes from infection. It regulates the healing process. And there's immune cells within our eyes, especially in the uvea there, that middle layer of the eye that I was talking about, and it fights intraocular, so inside of the eye, infection and inflammation. The cornea, that external defense, is our barrier, and it protects against pathogens getting further and deeper into the eye. So we want to be supporting that cornea, right? We don't want any of those corneal abrasions. And then our external defense is weakened, okay? And the immune responses, so within the eye, there's innate immune response, acquired immune response, and there's something called a mucosa-associated lymphoid tissue also. So our eyes have a mucosa, so that tissue also is associated with our immune system. Okay, and then I was reading, so this is really interesting. I'm just going to kind of leave this here. I'm not going to go too much into it, but this was an interesting study that PubMed had with our ocular immune privilege. So it's the eye limiting local immune and inflammatory response to preserve our vision. So our body's working for us. We have to support our immune system so it can do its job properly. Okay, so that's the point. So our body is, there's all these wonderful ways that it works to help us. And when you give your body the nutrients that it needs, it naturally can do these things. And this is pretty cool, you know, that the body does this for itself. And then we have to talk caution with medication. So what happens with autoimmune disease? If you go the conventional route, there's suppressive therapy, right? Steroids, suppressing the immune system. So corticosteroid, long-term use, there's lots of side effects, right? Cartilage damage, the whole gamut, it's real bad. But we're talking about eye health today. So, right, trying to stay on the straight and narrow here, because I'm really good at going off on tangents, but I'm being good here in this webinar. So long-term cataracts and glaucoma, right? So you don't want to be on corticosteroids, and think about your eye health. So if you're developing these issues and you're on a corticosteroid, try and think of another way. Try the natural route and see if that can help you, okay? And then what's the big medication that's in the news now? Hydrochloroquine, right? Hydroxychloroquine, Plaquenil. And so this is an immunosuppressive. So let's just take a moment and think about this, okay? So yes, when your immune system is in overdrive and you need to suppress it and you're in this extreme state, yes, it is helping. But there was somebody in the news, somebody very popular or not popular, right, who is taking this as a preventative medication, and it's an immunosuppressive. So let's just think about, is that the right thing to do? We're talking about, and what I've been talking about in these lectures is proper immune support, immunomodulation. And some people, if you don't have an autoimmune condition or any sort of other issues, so yes, immune boosters is what you need to protect yourself. So think about that. Is this the right thing to do? This hydroxychloroquine is an immunosuppressive drug. It's a classified drug in DMARD, which is disease-modifying anti-rheumatic drug. Okay, and it's used for autoimmune conditions. It's also, you know, it's an anti-malarial drug. And it decreases pain and swelling with arthritis. Okay, but the side effects are rampant. Okay, so when you look at a drug like this, you want to use it specific for a situation when there are no other options. Okay, that's, you know, I'm not here to say don't take medications. I'm here to say use it with caution, and let's use a little common sense. Also, that's very important. So if you're on medications, and a lot of medications for a long time, there's lots of side effects for a lot of medications. And then what happens is you go to your doctor and you have these side effects. What do? Put you on another medication for the side effect. And then that medication has another side effect. I mean, it's a real hamster wheel that you get into. So I put this here as all these question marks, and stop and think what your body really needs, okay? And these side effects with and why am I using this with Plaquenil, with the hydroxychloroquine? Decreased vision is a main one. Light sensitivity, blurred vision, the halo effect. If you're on this and you're having any of these things, think about what you're doing to your body. And also loss of balance and coordination. So thinking about those, our brain health, you know, our cranial nerves, like what are we doing to ourselves? Are we taking the right medication for ourselves? You really have to stop and think. And now blood pressure and our eyes. So our whole body health affects our eyes, okay? If you're having high blood pressure, if you have hypertension, it's affecting your health, and you can tell with your eyes. So I'm going to talk about how it's affecting the eyes because it can lead to these eyesight disorders. So you really want optimal blood pressure, okay? And you can test it at home, easy enough to get tested, or go to your local drugstore and make sure that you're keeping your blood pressure in check. And I'm here to say there are many natural ways to do that, and working alongside, you know, if you want to do combined care, trying to wean off a medication with your prescribing doctor, as well as working with the naturopathic doctor who can also help you naturally decrease your blood pressure. There are definitely very effective, safe, healthy ways to do this. Okay, but hypertensive retinopathy, so increased risk of stroke and heart attack. Okay, so we really don't want to have this high blood pressure. Look at all these systemic issues. I have this picture here and you can read it for yourself. So this hypertension, you can have permanent vision damage, okay, if bleeding occurs. The vessels in the retina become clogged. The retina doesn't get the the nutrients, and then the vessels start swelling. So what does this mean? There's small infarcts, aka mini strokes, right? Not lack of blood flow getting to the retina. High blood pressure, you're damaging these retina vessels, affecting your brain, right? So medical emergency, and you want to be aware of this. And so symptoms of hypertensive retinopathy: headache, a really bad headache, blurred vision, loss of vision. If these things are happening, get care right away, okay? Signs of stroke. So unfortunately, I witnessed this firsthand just a few months ago, and time is of the essence here if you do see this. And it's a scary thing. If anyone's seen somebody go through this, you know that you have to act quick. So you really want to know. And vision, blurry, double, sudden loss, temporary loss in one eye, rapid involuntary eye movement, they may not be responsive, numbness, weakness, paralysis. And it's also typically one side. Speech, they're not speaking, or it's difficult, or it's slurred, fatigue, lightheaded, there's vertigo, headache, confusion. So know the signs of stroke and get help right away, okay? Because they do need immediate medical attention. Diabetic retinopathy. So this is where there's sugar buildup in the tiny retinal vessels. So, we think about, diabetes, but think about the eyes and it affecting the eyes. And you can see this, when you get the imaging done with that non-invasive retinal imaging that I'm telling you about. The vessels there swell and rupture. It leads to swelling of the eye and visual disturbances. So if you're having problems seeing, let's look deeper into your health, your overall wellness, and what's going on. There's macular edema. So edema means swelling. Vessels leak due to too much sugar. Proliferative diabetic retinopathy. This means abnormal blood vessels are forming to replace the ruptured ones. So it's really just like a chaotic mess that's going on back there, and it prevents now proper nutrients to get to the eye, and then even more bleeding occurs. So you really want to prevent this diabetic retinopathy. It's not a good place to be. You're not going to be feeling well. And overall, within your whole body, you're not feeling well either. So test your blood sugar daily. Keep the blood sugar under control. Measure your blood pressure daily as well, and try your best to maintain a healthy weight. That's going to help. And let's take a moment to talk about nutrient-dense food. So as humans, we're trying to maintain, for the average adult, we're not trying to grow anymore. So we want to take just the right amount of food in moderation, but have it be nutrient dense. So a real bang for your buck. So what does that mean? Like organic, non-GMO, plant-based diet is optimal. Get the nutrients into your cells, give the body what it needs. Your cells are going to be rejoicing, and so are your eyes, and you're going to feel better. Okay, so just more proof, more information to get you eating those veggies, eating those healthy vegetables that are good for you. There's a whole world out there, and there are wonderful preparations to make delicious, healthy sauces. Find someone that makes good food. I'm always posting about it. Just find a good way to get those good veggies into you, make them taste good, and make it part of your healthy habits. It's really super important, and avoid the sugar. Okay. When you've got diabetic retinopathy, that's the last thing that your body needs. When you look at veggies and fruit, so what do they have? They both have fiber, which is really good for you. Veggies, though, they're full of all the macronutrients, the good protein, the good fats, the good carbs that you need. And what does fruit have? It's got the fiber, but it's got the sugar. So when you're dealing with diabetes, that's not what your body needs. So really avoid the fruit, especially if you're in a bad state, and especially if you're dealing with diabetic retinopathy, and getting proper exercise for you. Okay. I often talk about the blood type specific diet, things like that. So I'm always happy to talk about that stuff. And UV rays, so long-term exposure, where, cataracts, it's the clouding of the lens inside the eye due to many years of exposure to these UV rays. something called surfer's eye, where there's abnormal growth of the sclera due to excessive exposure to sun, wind, sand, and dust. It can be repaired surgically, but it may also return. So getting that under control is important. Macular degeneration, that's where the cell degeneration of the macula, right? Increased risk with sun exposure. Smoking is also a genetic disposition here. Cancer, so eye and the skin around the eye, the Skin Cancer Foundation reports 10% of all skin cancers on the eyelid. Who's putting sunscreen on their eyelid? You know, you gotta wear your glasses too, but what's the other thing connected here? You support your body by getting proper nutrients, proper antioxidant load, keep the inflammation down, avoid the processed food, avoid the non-organic, the GMO, crud crap, right? And then you don't let the cells proliferate, and then you're not setting the breeding ground for the big C, right? So let's try and keep everything under control the best that we can, right? Let's use all the tools in our toolbox and get the healthy food in us, get the chronic conditions down, okay? So that we don't let these cells grow crazy and rampant, okay? But, you know, so protecting the eyes, you know, and then using, you know, just eat well, and it's going to protect your overall skin. And we're talking about eye health, right? Okay. Because the vitamin D, the sun, it's our source of vitamin D, right? It's been giving our sunlight and the energy to the world, and it's what our plants need. The sun's not the bad guy. It's when you eat that crud crap, you know, mixed with overexposure, and then you get the burn, right? That inflammatory response in your body, and now you've got all this processed junk in your body. It's a breeding ground for the big C, right? We don't want that. So what can you do now? So eat like your life depends upon it. You know, I do these talks, I do these lectures. This is how I spend my life, talking to my patients. And nutrition is key. It's first and foremost. That's, you know, when you go to a naturopathic doctor, they give you a big sheet of information, tons of information. I'm here to educate and help. As naturopathic doctors, that's what we do. We love to do it. And the first thing is nutrition. So it's so important what you're eating and making good choices. You know, we want to thrive throughout our life. And we don't just want to be surviving. We want to be enjoying our life. And you can do that when you give the body what it needs so that you can feel well, you can feel better. All right. I say this with all the passion that I have because I've been down that road of not feeling well and having chronic illness, and it really stinks. And I thought I was doing things. I thought I was eating all the right healthy foods, but sometimes you have to find what the healthy food is for you, because it does matter. It's individualized medicine. So naturopathic medicine, all this natural stuff, it's individualized, not independent, individualized medicine. Specific for you, what you need, what's good for your family or for your friends might not be what you need, especially if you're in a state with hypertension or diabetes. There's specific needs that need to be met with you, certain micronutrients that you need. And if you can get them from food, that's great. So find a doctor who can guide you through these lifestyle changes. And then also turn to your support system. If you have a support system, I know people who don't have a support system, and that's okay. So, but you just have to find the help for yourself in whatever ways that you can find it. So just making sure that you're supporting yourself properly, and stay hopeful. Okay. Hope is a big part of wellness, feeling better. So I encourage you to feel hopeful. Yesterday I talked about the emotional guidance scale. So if anyone's stuck with their emotions, reach out. I'm happy to send that sheet to you, and go ahead and watch that video that I did, and find the root cause. This is so important. Heal yourself to reverse chronic conditions, especially now. If this hasn't been a wake-up call with everything that we're dealing with right now, I don't know what is. So you definitely don't want a chronic condition, because it's making you more susceptible during this time. Okay. The terrain, our bodies that we have within ourselves, that's the best defense that we can have. Okay. So it's really important. That's our best defense. And our immune system, that's you know, there's 70% of it in the gut. So thinking about your gut health. So nutrition, and this is a picture of some bilberries there. I thought that they were so pretty. You know, and you think about doctrine of signatures, if anyone's ever heard this term, where you eat foods that resemble body parts. So look at these foods, you know, they're full of color, which means, you know, there's tons of flavonoids, antioxidants in there. And what do they look like? They look like little eyeballs, you know, just like blueberries do also. So, you know, just eating food to support your body. Okay. You know, and listen to your body. The more healthy food you eat, you can tune into your body, and then your body tells you what you need. You know, if you need citrus foods, you could feel it, you know, and then you give yourself some citrus foods, you know, or you take some vitamin C, you know, so keep yourself healthy so you can tune in to what your body needs also. So you want these colorful fruits, vibrant veggies. Okay. Fruit, obviously, if you're not dealing with diabetes, but otherwise, you know, have some fruit, especially if you're going to have fruit, have it in the morning on an empty stomach. Because fruit's really great also at detoxing the body, but when you eat it on an empty stomach first thing in the morning, green leafy vegetables and good fats, you know, and tons of these that you can get from the plant kingdom. So tons of good fats there, and minerals and vitamins. So all the foods for your eyes. And I love this little picture of the carrot, because what is this also? Doctrine of signatures. A carrot looks like eyeballs. In fact, I had a conversation. This was God, this was maybe a year ago with my good friends, her kids, and we were talking about that. And I said, "What does a carrot look like?" And they were like, "Eyeballs," and it was so cute. It's like they made that connection at so young. I love having those conversations with little kids, because then it kind of makes food fun, and they go, "Oh, this is good for my eyes," you know, and then they eat it. They connect that food, the food as medicine. So it's a good one. So beta carotene, you know, think about the retinal health, especially the rods, they support that. Tons of food with beta carotene in there. Bioflavonoids to support, you know, to avoid cataracts and the macular degeneration. Lutein and zeaxanthin, also with the cataracts and macular degeneration. And eat your greens. So all the foods are listed here and you can reference them. And then there's even more foods for the eyes. So quality omega-3 fatty acids, especially to support some dry eyes, macular degeneration. Flax seeds are that, walnuts. And think of walnuts, you know, they look like brains. You know, you're just eating little brains right there. So you're supporting your brain health. Chia seeds, hemp seeds, seaweed and algae. You know, think about what all the fish are eating. They're eating that quality, you know, well, they're eating the seaweed and algae. And that's where they're getting the omega-3s. So maybe we should be eating that also to get our omega-3s. The selenium to support macular degeneration. And selenium is also great for immune support, as well as zinc, which is listed right there. And Brazil nuts, so just have 1 or 2 Brazil nuts a day and you've got your dose of selenium. Of course, you can always supplement with that, but you know, I'm talking about all the food that you can eat to support your eye health. Zinc to avoid, you know, if you've got night blindness and macular degeneration also. So think about zinc, get it tested, find a doctor who tests for that stuff, and all the foods to support that. Okay. And there's tons of food that have zinc in it. And then there's even more food for your eyes. So vitamin A, also, you know, the beta carotene was dealing with the retinal health of the rods and dry eyes, as well as vitamin A, night blindness there. Vitamin C, cataracts and macular degeneration. And what are all these foods too? They're all anti-inflammatory. You know, antioxidants support too. So you want a lot of antioxidants in the body to decrease the inflammation. You don't want that oxidative stress, and that supports the body, right? So sometimes that relationship of inflammation and oxidative stress, so you want a lot of antioxidants to keep that inflammation down, okay? Because we need some sort of amount of inflammatory response, but not high. And especially with autoimmune condition, you got to calm all that down, that inflammation. Vitamin D, it's beyond a vitamin, it's a hormone. And having the proper levels of this is huge. So the best source of this is from the sun, or getting a quality supplement, but at the proper dose, right? So you want vitamin D at just the right level, from 60 to 80 on your blood work. And every 10 points it's below 60, you supplement 2000 IU. I see a lot of people who are really deficient in vitamin D, and they're not feeling well, okay? Your mood's affected. Vitamin D affects so many cells of the body, hormones, you know, our body's craving them. Get small doses in food, but not enough. You really have to get it from the sunshine or take it for a supplement. Vitamin E, you know, for macular degeneration also. So a lot of these things, you know, macular degeneration occurs and cataracts typically, you know, later on in life. So there's so much that you can do along the way to help to offset it and prevent it. So tons of food in there that you can get. And lifestyle. So you really want to have UV ray protection year round. And think about that blue light protection. You know, we're all on our computers so much, our phones. So I've got right here, if I take it off now, if you guys see it. So this is my can't even see it because I've got, this is my blue light protector. You can see it there on the Facebook Live video. And it really does make a difference. I was having, this was months ago, but I was getting headaches a lot. You know, it was long days, and I realized I was staring at my computer a lot. And what changed? I got the blue light protector, and world of difference. You know, think of blue light blockers people are wearing. They like to wear those. Getting amber light, you know, you can change the settings in your phone, and you can have an amber light background in there, and that can help also. So anything to protect you against that blue light. Why? That blue light suppresses melatonin, and melatonin helps us to go to sleep. Okay. But you don't want that suppressed. You want melatonin to help you go to sleep. So if you're on your computer, you're on your phone right before you go to sleep, that could really be hindering getting a good quality night's sleep. So try and get something to protect that blue light, and to protect your eyes, because it protects your retina and then protects your brain health, right? Proper exercise for you, and making sure you're sweating, you know, so that means that you're detoxing also, and you're getting good sweat on. It's really great, you know, for your cardiac health. You know, as long as you don't have a cardiac condition, let's just support the arteries and our heart health every day with a little bit of cardio, right? Get yourself moving, move the chi, right? So then you have that good chi in the eyes, right? When you look at someone and you know, like, oh, they've got bad chi, or oh, they've got good chi. You know, you can tell from the eyes how they're doing. You get it moving, because things get stagnant. And where does pain come from? You know, with pain, a lot of times I see stagnation. So you just move it and you feel a lot better. People are afraid to. They're like, oh, you know, I don't want to move it. If there is no trauma or no injury and suddenly you have pain, chances are it's pain from stagnation, and you just have to move it. So get it moving. And eating a lot of processed foods, dairy, inflammatory foods, gluten, and it causes stagnation, because what's it causing? Inflammation. And then inflammation, things can get stuck, right? It's just not good food for us. Our body doesn't know what to do with these foods. Eat food that's food, not food that's in a package and it's not actually food. It's crazy. And decrease stress. So meditate on World Meditation Day, whatever it is that works for you to decrease stress. Find out what it is. Find out the best ways to cope, whether it be essential oils, working out, finding out for your blood type, the best type of workout for you. O's release stress hormones, doing strength. A's with yoga and Pilates. B's outside hiking, golfing, tennis, things like that. A, B's are kind of combination of everything. And if I said your blood type and you're like, oh my God, like I hate yoga, but I'm an A. If you're resisting something, it might just be because it's the one thing that you need. It happens. So protect your eyes. So our UVA and UVB rays, they do penetrate our retinas. The UVC gets absorbed by the ozone layer. So then think about, let's do all the right things as humans to protect our ozone layer, right? So it's really important, because we don't want to be fighting something else when we were brought into this world, you know, and then here's humans making decisions and messing it up. So let's be really good to Mother Nature and really good to our earth. That's like a whole talk about itself. So I don't want to waste time on that, but you know, there's a lot to think about. How are you treating your lawns, you know, and all that stuff? What are chemicals and using, what are you using on your body, and what are you using to clean your house with, your home with, and your car with, and all that stuff. So really, you know, think about that. Be good to Mother Nature. She deserves it. And if you're having excess outdoor exposure, maybe wearing some wraparound frames, okay, to support, you know, the outside of the eyes that might be getting some of that sunlight too that's coming in. Impact resistance with sports or jobs. There's polycarbonate lenses, protective eyewear in hazardous conditions. So doing any lawn work, garage cleaning, chores around home, sports, you know, it happens. You're working out there in the lawn. You don't think about it, but wear some protective eyewear. You got to protect your eyes, okay? As well as being outside and not getting that exposure. So there's my little goddaughter, Gracie. How adorable is she, that little munchkin? And look at those sunglasses she's wearing, looking like a little cutie patootie there. So get sunglasses for the little ones. All right, start young and wear good quality sunglasses year round. So I know, you know, you don't think about it all year round, but you need to. So I know in my car, I've got, you know, my sunglass storage there. So I've got a few sunglasses, you know, just lying around, so that I always remember to be wearing them as often as possible. Get one that blocks out nearly, 100% UVA and B protection. You know, the screen's out 75 to 90% of visible light, and the frame, get a frame that fits right, should fit close to your eyes and contours the shape of your head. So if you're not sure, ask somebody, so, tons of ways to get the right eyewear for you. Prescription glasses can have tints in it, so that's really helpful. That you get, the year-round protection automatically. You don't have to think about it. So make sure it's got that full UV protection. And even soft contact lenses can offer UV protection. So if you're a contact lens wearer, there you go for it. And there's Gracie again, because we can't get enough cuteness, right? And they're so sensitive to the UV rays, so their exposure risk is increased. And look, she's got these big old sunglasses, so she's got lots of coverage. So way to go, my friend Christy, way to go, super mom. UV rays penetrate their retinas easier, and their lens filters out less UV rays. So let's really protect our little ones. And even on an overcast day, so there's almost a third of solar radiation still reaches the earth. So we still have to wear our sunglasses, protect our eyes on those days where it's a little cloudy. And at the beach, the sand and water reflects an additional 25% of the UV rays. And then the snow reflects up to 80% of UV rays. So making sure you've got those goggles on and you're protecting yourself in all sorts of conditions. And so here's some supplements. Again, this is not for you to take all of them. Get on board with a naturopathic doctor who has been trained in proper supplementation, okay? And you want to be taking a good quality supplement. There are a lot of bad, really bad supplements out there, okay? Be on a good quality supplement. The supplements that you could be taking, if they're bad or they're not for you, could be contributing to why you don't feel well and could be contributing to chronic illness. Okay, so I see this a lot. Less is more with supplements, and you don't want to be on them forever. You want to be able to get off of them. Okay, that's the point. With the exception of a few, so like probiotics, which is good for gut health, that I've listed there, and maybe some vitamin D, especially living. I'm here in New York, in the Northeast. We don't get the sun exposure, the adequate amount that we need. So yes, supplementing, but properly with it, knowing what your vitamin D levels and taking the right amount. So supplements, so lutein, zeaxanthin, astaxanthin, vitamins A, C, D, and E. But be careful, those fat soluble ones, A, D, and E, they're fat soluble, which means if you take too much of it at the incorrect doses and they build up, they become toxic because they're sitting in your fat tissue. That's not what you want, okay? Selenium and zinc are also great for immune support, but they help the eyes, like I was talking about. Resveratrol perhaps can help you. Using homeopathy, I was just talking about Chloe, my little doggy, and that's what I've been using to help her. She has retinal degeneration. I give her homeopathy over the years, and a variety of different ways that I dose it, but pretty much I'm putting a pellet in her water, and it has saved her eye health, and it gives her that little bit, whatever she can see. I know she's hanging on to something, but she can still see. And I thank homeopathy for that. So find a practitioner who knows how to prescribe homeopathy properly. Immune and gut support, anti-inflammatory support, and proper antioxidant support. So thank you. So I hope that this was all good information for you to think about, reflect on, and you feel free to follow me. I'm on Instagram, drdawnd, and I will post this onto my Instagram, IGTV. This will also be posted on our our Inner Source Health YouTube page. You can follow me on Facebook also at drdawnd. And feel free to email me if you have any questions. My email is drdawn@innersourcehealth.com. So that's drdawn@innersourcehealth.com. And anyone can come in. You can come in for you can schedule a 10-minute free consult with me. If you're curious, if you have any questions about naturopathic medicine and how it can help you, I'm happy to talk with you about how it could work and have a 10-minute discussion about you specifically and what you can expect in working with me. So feel free to reach out to me to schedule that, and I'd be happy to have that conversation. And let's see if I can get into, okay, so I'm in the chat here, and let's see if I can access, if anyone has any questions, you can let me know now. I know that I covered a lot. Okay. Um, so you can always email me if you have any questions, and I hope that this was enlightening. Let's see, I'm trying to check in and see if I'm missing anything. I've got the webinar going and the Facebook Live. So awesome. Well, it's a beautiful day here. Oh, Teresa, so let's see. I got a question. This is an interesting one. Any yoga, any yoga poses, I think is what she's asking me, good for eyes? So I would say, so like I was saying before with the blood type specific diet, A's really benefit from yoga and even Pilates, anything relaxing. But I think yoga is really great. So if there's high stress load and yoga helps to relax you, I say go for it. I just did it yesterday. So I love, and it really depends. So yoga is always a practice that is very individual, right? For yourself. So, and I say, the best thing you could do is forget about everyone else in the room and go and try yoga. Try these yoga at home. I just did one yesterday through my gym. They had a yoga class and it was great. So I love the downward dog. I love hip openers. So I guess the way I could answer this, because it's such a good question, and the more I'm talking about, I'm trying to actually think of my answer, right? That's what I'm trying to do here. So if there's any pain in your body, so I would say if you've got hip pain, do some hip openers, and the pigeon pose could be good. If you're feeling there's dolphin pose, the fish pose, cobra pose is really good. So if you're trying to strengthen your core to help with back pain, so doing a lot of poses like plank pose could be really good also. So I guess you could just think about where in your body you're feeling the pain and just do it. But I think overall, like a good vinyasa flow yoga can be really good at decreasing the stress, decreasing the blood pressure, which overall, can help your eyes, but nice and relaxing child pose, or sit in savasana. What is that? Just lying on your back with your palms up. And then how can you change your energy? So if you want a little bit more energy, you can have your palms facing up when you lay down. If you're feeling a little tense or anxious or a little jittery, then you can have your palms down. And then that maybe can calm down and decrease stress, and that could be really beneficial. So there's really tons of them, and it really depends on what you want. There's all different types of yoga, hatha yoga, so I mean, there's tons of it. So try it. But I recommend, give it a try. Even if you're afraid of it, there's that fine line between fear and excitement, so if you're fearing something, maybe it's really good for you. And when you get past the fear, you get really excited, and then you love it. And then you find something that's a really good, healthy habit for you. And then it becomes a part of your life and helps with your wellness. So I hope that answered you, Teresa. Okay. Great. Let's see. Oh, here we go. Let's see. Now I see some more. Okay. Any eye supplements? Yeah. So I'm not going to mention any specific supplements just because I don't particularly prescribe to any of them. Again, this is all about individualized wellness. So considering all of these, but again, be with a practitioner who you really trust and care about, and getting a quality supplement that has quality ingredients in it, making sure you're getting a supplement that's third-party tested, and it doesn't have there's a lot of bad stuff that's in supplements. So you want to make sure that you don't have them. One of them being, let's say you're constipated, I'm just thinking off the cuff, and the supplement has rice in it. That's not a good supplement for you, but maybe that supplement could be good for somebody who doesn't have that disorder. So there's so many things as a naturopathic doctor. So I ask, our first visit's 90 minutes. So it's a full medical intake. There's so much that I'm always asking. So I don't want to give a specific name of one. Do you recommend adding a vitamin supplement specifically for the eyes, or just diet? So yeah, so a great question. So I would say it's all, when I work with my patients, it's nutrition, lifestyle, and then supplement is the last thing, only as necessary, and I'm very conservative with how I prescribe my supplements. So I would say nutrition. So everything I was talking about, and go back to these slides, look at all the foods that are good for your eye health. But, I'll keep it simple for you. Whole food, plant-based, organic and non-GMO, optimal if we can. But get the quality foods in you. And then, based on lab work or clinically, if you're still having some symptoms and not feeling well, then get the supplements that you need that can only supplement your nutrition, right? The word's there. It's to supplement. It's not to rely on. We can't live on supplements. So nutrition first and supplements if you need it. So work with a practitioner who, you know, properly prescribes supplements. That's how naturopathic doctors were trained. It was part of our training, you know, proper supplementation with minerals and vitamins. So, so great. Okay. Oh, thanks, Mary. Thanks all. Okay, wonderful. Well, I'm going to say goodbye for now. I thank you all for joining me, and I'll see you guys next week. I have a great, I'm doing a talk with Dr. Pina Lejudice that I work with our special guest, Anton, and we're going to be talking about bioenergy therapeutics. So always that you can still support your body. Oh, I've got a raised hand. Oh, and okay, there we go. Oh, I see. Eating for your blood type. Are there books you? Okay. So I love with the blood type. I love using that for exercise. So I support the whole food plant-based diet. So veggies go a long way, and specific to each one for that. So no, I don't have a book regarding that for your question there, Cindy. And Angela, my friend is having some memory issues and she had a scratch cornea in the past. You think there is a connection? So have your, you know, we're all connected. Could there be? I can't say, but have her, you know, when she's willing and able and the doctors are open and she feels comfortable getting the retinal imaging done and seeing if there's anything going on. Well, first of all, you know, they could just see the cornea, you know, that's the exterior layer, see if it's healed. That's easy enough to figure out. And then also if she wants to go for the retinal imaging too. So just, you know, go to the doctor and get it figured out. You know, sometimes you get an answer and then you don't worry about it anymore. So sometimes, you know, could it be, could it not be? So if she's thinking about it and it's causing any stress or worry, just get an answer, you know, and then she might feel a lot better. So it may be, or it may not be, but always worth looking into it. But could it be something else? Potentially it could be something else. Might not necessarily be that situation, but it could be. So that's why I always say, get on top of your health, get the answers to what you need, because each person knows when they need to find the answers, you know, and finding the root cause to your health is key. And as a naturopathic doctor, that's what I do. So if you are looking for a naturopathic doctor in your area, I'm happy to assist you if you want to shoot me an email. I am doing 100% telehealth right now, which means that I can see my patients via video conferencing. So I am accessible to you also. So yeah, reach out, you know, and try and get a naturopathic doctor on your team because it will help your overall health and wellness. Okay, so thank you so much. And yeah, oh, I got more questions here. So yes, the replay, everyone who has signed up here, I will be emailing you the link here and it'll be on our YouTube page. So feel free to just subscribe for free at our Inner Source Health YouTube page. And there you can see all the webinars from all of our wonderful doctors there too. So yeah, alrighty, great. Thanks everybody. Bye now.